Hi, today I'm going to present to you a video demonstration of the totally modified sequence of K3XF cleaning and shaping in an uninstrumented acrylic block. This is the uninstrumented acrylic block. Now, the first step after access opening is to establish your patency. You can either establish the patency with a normal 10 size K file and never push it inside, just gently use a watch winding motion to insert it, and it can go about 0.5 to 1 mm beyond the apical foramen. There is absolutely no problem because the tip diameter is about 0.1 mm, which is much smaller than the average size of the diameter of the apical foramen, which is about 0.25 mm. Now, in case if the 10 size file is finding itself difficult to get inside, in the case of a calcified canal, you can go in for a Pathfinder K2, K1. Here I am using a K2 which corresponds to an ISO 9. Same way, you put it inside the canal and gently with the watch winding motion reach the apical foramen. It can be about 0.5 to 1 mm beyond the apical foramen. Now, once you finished your patency, the next step is orifice enlargement. Now here, for the orifice enlargement, I am using a 25 size 8% taper 17 mm K3XF. This is a cordless handpiece from Sybron Endo Touch TC2. This is a fantastic companion for your endo because it removes the hassles of the cords and stuff like that. You can just charge it like your mobile, and then you have precise torque settings here. For the case of K3XF, I'm setting it at 450 to 500. I'm keeping it 500 because it's an acrylic block, and around 2.4 to 2.6 here again I'm using 2.6. Here again I'm using 2.6. So the first step of orifice enlargement, you take your EDTA gel, just gently insert it into the canal orifice and then start. You can see it reversing. The moment it binds, you can see it beautifully reversing out. So maybe just a few into the coronal third, you stop with your orifice enlargement. You can appreciate the beautiful reversing of the instrument. Wipe it, remove the orifice shaper and keep it. Irrigate copiously with saline. In the case of a clinical scenario, I would prefer to use sodium hypochlorite as the working solution. Now, the moment I say working solution, it means that you just gently flood sodium hypochlorite into the pulp chamber and use saline as a flushing irrigant. Okay. Now, once you have irrigated copiously with saline, now the next step is working length determination. Here, since it's an acrylic block, we go in for the direct determination of the working length. I can see here, just coming inside. So I adjust my length. Yeah. It's about 18 mm. So the working length is approximately 18 mm here. Once my working length determination is completed, I start with my glide path. The most important key feature behind any rotary instrumentation is the glide path. Here I am using a K-flex file for my glide path because the advantage of a K-flex file compared to a K file is that this has got a diamond-like cross-section, as a result of which the binding inside the canal is much lesser compared to a conventional K file which has a rectangular or a square cross-section. Now this is 15. I start my glide path with 15. Now I adjust the working length to 18 mm. Take EDTA, flood EDTA into the pulp chamber, and this is yet another magical innovation from Sybron. This is the M4 handpiece. This is a M4 handpiece which is connected to your conventional micromotor. The advantage of using an M4 handpiece is that the glide path can be established with relative ease. You can do the same thing with hand as well. So what I'll show you is, I'll show you a glide path of 15 with the M4 and 20 with hand. That's it. That's it. That's it. That's it. Over. Makes your job very simple. Very, very simple. Irrigate with saline. And the next step is continue your glide path with 20 K-flex file. Now here I would prefer, I'll show you with hand. Apply EDT on the pulp chamber. Adjust it to 18 mm working length. Now this is how you do it with hand. Take it inside, the same watch winding motion, reach the apex. Watch winding, reach the apex. Watch winding, reach the apex. Watch winding, reach the apex. Never rotate a file or never use push and pull motion. The rotation, push and pull, all that is obsolete now. Now there is only one motion, the watch winding motion. Now we have established the glide path up to 20. This is the key step behind the success of any rotary instrumentation. I repeat, behind the success of any rotary instrumentation, establishment of a glide path up to size 20 is the key step. Now once I finish the glide path, now the canal is ready to receive my rotary instrumentation. Okay. Now the instruments that I'm going to use, the sequence that I'm going to follow is not the sequence which is recommended by the company. I have slightly modified the sequence. This is K3XF 25 6% taper. I start with this. Now what I do is, I don't go to the full working length. I know 18 is my working length, so 2/3 the working length would be about 12 to 13 mm or 14 mm max. Okay. EDTA followed by I stop. The moment it binds, I stop. That's it. Can you see it unwinding, reversing? Beautifully reversing. That's it. So I stop with 2/3 the working length. That's the key. Now I continue my cleaning and shaping with a 25 4% taper. Now here I go to full working length. I use my 25 4% taper and I reach the working length. Yeah, easily I reach the working length. Okay, I reach the working length. Now my preparation is over. Now in cases where my initial apical file size is only 10, like for instance a thin or a narrow mesiobuccal canal or a mesiolingual canal, or the buccal or the lingual canal of a premolar. In such situations, I stop with just these two files, that is the 25/6% to 2/3 the working length, which is followed by a 25/4% to full working length, and now I obturate with a 25/4% Gadaperka. Let me see. This is the 25/4% GP. Any standardized Gadaperka is fine. This is a millimeter marked Gadaperka with 16, 18, 19, 20, 22 and 24 markings. Now I insert it and I see perfect. Exactly at 18 mm. If you can see here, exactly at 18 mm. It fits in precisely at 18 mm. Okay, now in case if the canal is a slightly bigger canal, like the palatal canal or the distal canal, I continue my preparation with, or I repeat my preparation with the 25/6%. I go back to my 25/6%, go to the full working length and reach my working length. And I reach my working length. You can see it reversing until it reaches the apex. See, beautifully it reverses. The moment it binds, it reverses. The moment it binds, it reverses. This is basically a basic rotary, so it doesn't have that excellent cutting efficiency of a twisted file. If it's going to be a twisted file, it would have reached the apex in no time. Whereas a K3XF will take slightly more longer time to reach the apex, but the advantage is it's a pretty sturdy file and there's no question of instrument separation. Yeah, so I've reached my apex. I've reached the working length. So what I do now, I nicely flush it with saline. Once again, flush it with saline. Now I go for my 25/6% Gadaperka. This is purely when you encounter big canals like palatal or distal. Otherwise, for all narrow canals, you can stop with 25/4%. So here you can see the exact fit at the apex. You can see the exact fit at the apex for a 25/6% Gadaperka. Beautiful three-dimensional fit at the apex with the 25/6% Gadaperka. So this is purely optional. So that completes your preparation with only two instruments. That is the orifice shaper followed by two instruments. And this is an optional instrument, optional file, a 24%. A 24%. This is in the case of very narrow canals. If the 25/4 is finding it a bit difficult to reach, then you can go for a 24. This is purely optional. This is not necessary for all the cases. So for all routine cases, if it is a narrow canal, you start with the orifice shapers, you go for a 25/6% to 2/3 the working length and reach with 25/4 to the full working length, and you can obturate at 25/4. Only in the case of bigger canals, you might have to recap it once again with the 25/6% to working length and obturate at 25/6%. Thank you.